Okay, so today we're going to go over the musculoskeletal system, specifically disorders of it. This is still pathophysiology. This is going to be our third unit in the class, even though we're like 2 weeks in. So on the first slide, it's just a picture of a bone anatomy. So like you're going to look at the growth plate, the different parts. So the epiphysis, metaphysis, diaphysis, metaphysis again, and the epiphysis. So the diaphysis is going to be towards the center of the long bone. We're going to look at the different parts, compact and spongy, and the medullary cavity where the blood vessels and the endostem and the yellow marrow are at. So moving on, since we can't even look at that right now. We're going to look at the skeletal system. The skeletal system includes bones and cartilage of the skeletal system. Okay. Connective tissue structures, i.e. ligaments and tendons that connect the bones and join muscles to bone. The axial skeleton is composed of the bones of the skull, the thorax, your vertebrae, and forms the axis of the body. So basically, just like the nugget portion of your body, I guess. No limbs. Meanwhile, the appendicular skeleton consists of the bones of the upper and lower extremities, including the shoulder and hip. Okay, so your limbs and your pelvis. All right. This one has notes. All right, bone, cartilage. Cartilage is a firm but flexible type of connective tissue. So the composition is cells and intracellular fibers embedded in amorphous gel-like material. There are 3 different types: elastic cartilage, hyaline cartilage, and fibro cartilage. So that should be a review of anatomy. All right, intracellular fibers found in skeletal tissue. Collagen, an inelastic and soluble fibrous protein, has great tensile strength. Tissues that contain large numbers of collagenous fibers genuinely appear white. Elastin, the major component of elastic fibers that allow them to stretch several times their length and rapidly return to their original shape when the tension is released. Tendons and ligaments, dense connective tissue composed largely of intracellular bundles of collagen fibers arranged in the same direction and plane. Tendons, they attach skeletal muscles to bone. They're inextensible, enveloped by loose connective tissue, blood vessels, and nerves. Are fibrous thickenings of the articular capsule that join one bone to its articulating mate. Ligaments, these are fibrous thickenings of the articular capsule that join one bone to its articulating mate. So ligaments and tendons are basically the same shit. Articulations or joints, areas where 2 or more bones meet. So this could be a lot of like patients, have knee problems or shoulder problems. Do we remember from anatomy that your shoulder is the most often dislocated joint in the body? What type of joint is that? Ball and socket. Let's see if that's actually right. Is the shoulder ball and socket? Yes! Oh my gosh, we remembered it right, guys. I'm so proud. There's coffee, by the way. Let's see. Causes of musculoskeletal injuries. All right, now we're getting in it, the nitty and gritty. Blunt tissue trauma, disruption of tendons and ligaments, fractures of bony structures. So these are major causes. Types of injuries. Soft tissue. These are going to be contusions, an injury to soft tissue that results from direct trauma and is usually caused by striking a body part against a hard object. Hematoma, a large area of local hemorrhage. Do we remember what hemorrhaging is? Isn't that when the body starts clotting? Okay, let's look up. We just learned this. Is bleeding caused by damage to a blood vessel which can occur inside? Oh, okay. So clotting is what fixes the hemorrhage. So it's just bleeding. The body starts hemorrhaging. It's just bleeding. Okay. They're hemorrhaging. They're bleeding. Start being dramatic. Laceration, an injury in which the skin is torn or its continuity is disrupted. So that can be like cuts and stuff. Now we're on to joint type of injuries. Injure. I love how I lose my English. Joint injuries. So strain, that is a stretching injury to a muscle caused by mechanical overloading. And a sprain is involving the ligamentous structures surrounding the joint. Pain and swelling subside more slowly than in a strain caused by abnormal or excessive movement of the joint. So like people who run get sprains. Well, people who like weightlift are more likely to strain a muscle. There you go. Real world examples. All right, now we're going to look at acute injuries. These are caused by sudden trauma. This includes injuries to soft tissue, contusions, strains, and sprains, and to bone, fractures. Overuse injuries. These are going to be chronic injuries. So think of athletes. Include stress fractures that result from constant high levels of physiological stress without sufficient recovery time. All right, now we're going to do dislocation. These are displacement or separation of the bone ends of a joint with loss of articulation. Let's look up exactly what articulation is in this context, so that way, meaning health or anatomy. So articulation in this content is the state of being joined. So just together. All right. Well, so it's not together anymore. There you go. It's just like meh, outside. Loose bodies, small pieces of bone or cartilage within a joint space. What would be an example of a loose body? Let's ask ChatGPT. Of a loose body injury. A loose body injury occurs when a small piece, blah, blah, blah. We just went over that. So like a knee injury. So when like you bust your knee and the cartilage breaks off the knee joint. Oh, wow. Okay. Now we're going to look at fractures. Fractures, sudden injury, stress or fatigue. Repeat wear and tear / overuse. Pathologic, so metabolic bone disorders, osteoporosis, infections, tumors. I'm gonna actually use my computer to charge this and plug in my charger because I thought I was charging all night on my computer, but this POS don't allow. Okay, doesn't ever want to fucking work. I feel like I'm getting fucked with right now. Okay, now it's charging. Like it wasn't charging all night. Okay. Sorry, pause. Fractures, sudden injury, stress or fatigue, repeat wear and tear / overuse. Now we're going to get to pathologic. So these are going to be metabolic bone disorders, osteoporosis, infections, and tumors. All right, then it has just images of different breaks. So you have impacted. That's going to be when like the bones normally like this. It's going to, okay, imagine like this is the bone. It's going to just be like pushed in, if that makes sense. Impacted. So like, it's just like the end is, you know what I mean? Okay. Spiral, that's going to be more like an oblique, you know, type of fracture. So the bone's going to be like kind of like this. You know what I mean? This is like not a good visual. You're gonna have to like look this up on your, I'm gonna draw it for you. My 2-second drawings. Okay, impacted. So the bone's gonna be like that. Okay, like pushed in. Okay. And that's gonna be our spiral. So it's like not straight. Transverse, of course, is going to be straight. Okay. Hold up. Oblique and spiral look the same. Okay, so spiral is like, I guess, when it spirals throughout the bone. So not only, so it's in multiple places. And then oblique is just the one like straight sideways. The complete bone is going to be like some of the bones outside of the body. And then comminuted, that's going to just be like the little splinters. Comminuted. I don't know, you gotta look at a picture for that one. Then there's another imaging of like the different ways. Also, when bones break in the body, I know we haven't gone over this, and this is not in our slides, our teacher just told us, but or our 1-minute nursing videos. But when the bones break in the body, the muscles act as rubber bands. And so when that happens, the tension that the bone was holding on these rubber bands disappears. So the muscles start pulling the bones closer because the elasticity is gone. So that's why she was saying, our teacher, you see people in hospitals like with their leg up in the air. I forget the exact medical term she was commenting on, but that's why you see like the orthopedic doctors have like their legs in those positions to hold it, because the muscles will actually start trying to pull the bones like how it normally does, but the bones can't withstand it anymore because it's broken. So just think of the muscles and tendons and everything around it like rubber bands around the bone, and the bone's holding it like taut and whatnot. Okay. Oh, here's the photo. You know what? I'm just gonna like try to whip this around for you. You see him? Okay, I feel like that was enough. Okay. Now, we are on compartment syndrome. These are going to be, compartment syndrome is this a condition of increased pressure within limited space. So abdominal and limb compartments that compromises the circulation and function of the tissues in the space. Abdominal compartment syndrome alters cardiovascular, hemodynamics, respiratory mechanics, and renal function. The discussion in this chapter is limited to a discussion of limb compartment syndromes. The muscles and nerves of an extremity are enclosed in tough, inelastic fascia, often termed a muscle compartment. If the pressure in the compartment is sufficiently high, the tissue circulation is compromised, causing the death of nerve and muscle cells. Permanent loss of function may occur. So you have to remember the 5/6 P's of pain, okay? This is for you nurses. Pain, usually the first symptom to appear. That's one. Paresthesia, reduced sensation. Pallor, paleness. Paralysis, complete paralysis is a late stage symptom. And pulselessness, so a late stage symptom. That means when you go to feel for a pulse, you cannot. It also has a bonus one, poikilothermic, cold limb. I don't even know if I said that right, but if the limb is cold, you know, it's not getting enough oxygen, it's losing the tissue. The tissue's dying. Okay. Moving on. All right, now we're on bone cells. So osteoblasts, formation of new bone. Osteocytes, osteoblasts that become incorporated within newly formed osteoids. These assist with bone calcification, help concentrate nutrients in the matrix. And osteoclasts. These are major resorptive cells of bones. Resorptive. Major resorptive cells of bones. Why does this look weird? Resorptive is resorption, the process of breaking down and absorbing tissue or material. So resorption, because it's not it looks like reabsorb, but it's not. So that's why I'm like thrown off. Okay, this isn't because my English ran out this time. So resorption is a process of breaking down and absorbing tissue or material. Which we kind of know. Osteo is always going to be your bones. Let's look up blast. Let's look up our root words while we're here, since these will help us in the long run. So blast meaning Latin. Blast, so that's something that's going to be destruction. Class. That's not right either. All right, what does class mean in medical terms? To destroy. Okay. So if you see something with class, that's destruction. I don't know where Google is fucking me up with the last one. Blast mean in medical terms is an immature precursor cell that is in the early stages of development before maturing into a specific type of blood or tissue cell. So that's going to be the early stages, okay? And then sites. We often see sites, don't we? Hollow, or like a cell or container. So it just means like cell, okay? All right. Continuing bone cells. Skeleton is a dynamic tissue that undergoes continuous changes to maintain a steady state of homeostasis. Bone is subjected to a lot of wear and tear. Bone remodeling takes place to repair micro damage of the bone. Bone remodeling involves bone reabsorption and bone formation. 3 types of cells are involved in the process: osteoblasts, osteocytes, and osteoclasts. The osteoclast results in the release of minerals, calcium, from the bone to the blood. Why is calcium important, y'all, for the muscle surrounding the bone? For contraction, relaxation, and overall muscle function. It acts as the key signaling molecule in the process. I read that to you so that way I wouldn't tell you anything wrong. But I knew calcium was important for that process. Because remember, you like had to go through the whole actin and myosin bullshit. And so these ions bind to the tropin. Remember, it binds to it. You shift. And then, yeah, there was like this whole thing our teacher did with like, it was like it binds, shift, release, or some bullshit. But remember that, because remember, everything is interlaced and connected in this. All right, now we're on actions of hormones and vitamin D. Parathyroid hormone. This increases intestinal absorption of calcium and phosphate, decreases renal excretion of calcium and phosphate, increases bone reabsorption, decreases bone formation, promptly increases serum calcium levels, prevents increase in serum phosphate levels. Now, calcitonin. This decreases renal excretion of calcium and phosphate, decreases bone resorption, decreases serum calcium levels with pharmacologic doses, decreases serum phosphate levels with pharmacologic doses. Now, vitamin D. increases intestinal absorption of calcium and phosphate, increases renal excretion of phosphate, can increase bone resorption and formation. All right, those are actions of hormones, vitamin D. This is another slide on compartment syndrome. No, it just went back. All right, calcium regulation. So in this slide, it shows vitamin D and parathyroid hormone increases blood calcium. Meanwhile, calcitonin decreases blood calcium. How do they achieve their goal? So vitamin D helps with the facilitation and absorption of the blood calcium. We just discussed this. And calcitonin is a hormone, and it makes it where the body stops producing calcium. I'm pretty sure. Should we look that up? Let's ask ChatGPT. How does vitamin D and PTH increase blood calcium? See, this is the issue when you're studying, or no, when you're in class, because it's the teacher's just talking, so you're just following her lead, and so it's questions you would ask yourself or need to look, even if it's stupid, you don't really have time to, because either A, the class is so fast-paced, or B, it's something that you need to review that you should have already done prior, and now you're doing it, like us. Okay. So, the parathyroid hormone increases blood calcium because it's released when the blood calcium is low. It raises it in 3 ways. Bone, it stimulates bone resorption, breakdown, releasing calcium into the bloodstream. The kidneys cause the kidneys to reabsorb more calcium, so less is lost in urine. And vitamin D activation stimulates the kidneys to convert vitamin D into its active form, which increases calcium absorption from the intestines. Memory trick. PTH pulls calcium into the blood. Vitamin D, calcitrol, increases blood calcium. Vitamin D's main job is to increase calcium absorption from the digestive tract. It increases calcium absorption from the small intestine, also increases phosphate absorption, works with parathyroid hormone to maintain normal calcium levels. Without enough vitamin D, you absorb much less calcium from your diet. Blood calcium can fall, causing PTH to rise. Memory trick. Vitamin D equals digestive absorption of calcium. All right, now calcitonin decreases blood calcium. It is released by the thyroid gland when blood calcium is high. It lowers calcium by inhibiting osteoclasts, so less bone is broken down, encouraging calcium to be stored in bone, slightly increasing calcium excretion by the kidneys. Memory trick, calcitonin equals calcium goes into the skeleton. I'm gonna kill this dog. 1 second. Jeannie! Shut up! Oh my gosh. Okay. I don't even think we're halfway done, bruh. We're 23 minutes in. Alright, next image just shows parathyroid glands and how it interacts with the bone and the kidneys, calcium concentration, extracellular fluid, and the intestine. So basically everything we just discussed in their relation. All right, now we're on to bone remodeling. So you have resting phase, activation, resorption, reversal, and formation. So you have 5 stages. 1, resting, remains dormant until the next cycle. Activation, osteoclasts are attracted to the surface of the bone. Reabsorption, osteoclast generates an acidic microenvironment, dissolve or reabsorb the damaged mineral content of the bone. Osteoclasts dig out a cavity called a reabsorption pit in spongy bone or burrow a tunnel in compact bone. Calcium can be released into the blood for use in various body functions. Osteoclasts disappear. Reversal. Osteoclasts undergo apoptosis. Osteoblasts recruited attracted to the bone surface. Mesenchymal stem cells, precursors to osteoblasts, appear along the burrow or pit where they proliferate, increase in numbers, and differentiate, change into pre-osteoblasts. Then formation. Osteoblasts deposit collagen, which is maybe that's supposed to say collagen, which is mineralized to form new bone, mature into osteoblasts at the surface of the burrow or pit, and release osteoid at the site, forming a new, soft, non-mineralization matrix. The new matrix is mineralized with calcium and phosphorus. So this is a complete side note. I'm going to make note of it to look up. Did you know, like, when pregnant women will go through the pregnancy or whatever, they often lose a lot of the calcium in their bones and end up having to get root canals and stuff because of their teeth, because they needed calcium for the formation of the baby. And so it just starts going to the deposits. That's why they like recommend so hard for women to do prenatal and take all their supplements and everything, especially during pregnancy. Even not pregnant women just planning on getting pregnant, because it takes so much from the body. But we're gonna look that up after, because I mean, we want to be nurses and we're gonna see like exactly what we're learning and how it can be applied, because we're gonna have to help patients. So we're gonna look that up in a minute. This image is just showing some of the reformation process, so you might want to watch a video specific on that. All right, this slide is going to talk about osteonecrosis, causes, mechanical disruption of blood vessels, thrombosis, and embolism. Let's just do a recap on those two things before we move forward, so that way we know how we have them down pat. Thrombosis, I think this is the one with clotting, is the formation of blood clots that can lead to deep vein thrombosis and pulmonary embolism. So that's thrombosis is the clot itself, and then embolism I think is the loss of function. When a blood clot or another substance becomes an obstacle, it's an embolism. So thrombosis is the clot, embolism is where it stops and becomes an obstacle. Okay, so those are the differences. Vessel injury, increase intraosseous pressure. Let's look up that. Intraosseous. I'm not even sure if I'm saying that right. It's a medical technique for delivering fluids and medications directly into the bone marrow when intravenous access is not feasible. Increased osseous. I think my grandma got this. She has lots of knee pain and arthritis in her knees, and they just literally just shot in her knee like a hollow needle that was big as fuck, just straight in to give her the medication. It was very painful. And they like just spray and numb the skin. They don't like do any type of lidocaine in the area. So these people who are like getting injections in their knees and stuff to help manage pain, they literally are not really getting any type of relief for it. And that's so crazy. Okay. We're still on osteonecrosis. Now we're going to talk about blood flow. Interconnecting plexus, outer cortex receives supply from surrounding blood vessels, and some sites have limited collateral circulation. Interruption flow affects significant amount of bone tissue. All right, osteonecrosis, or death of a segment of bone, is a condition caused by the interruption of blood supply to the marrow, medullary bone, or cortex in the absence of infection. People treated with corticosteroids and or bisphosphonates are more vulnerable to developing osteonecrosis. So it's when part of your bone just dies. Because I guess everything in the body really is living. Even our red blood cells that have no nucleus. All right, diagnosis and treatment of osteonecrosis. All right, diagnosis of osteonecrosis is based on history, physical findings, radiographic findings, and results of special imaging studies, including CT scans and technetium 99mm bone scans. I don't know what that last one is, but we're gonna move past that since whatever. Treatment of osteonecrosis depends on the underlying pathological process. In some cases, only short-term immobilization, non-steroidal anti-inflammatory drugs, exercises, and limitation in weight bearing are used. Osteonecrosis of the hip is particularly difficult to treat in people with early disease. Limitation of weight bearing through the use of crutches may allow the condition to stabilize. Ooh, that's also what I want to talk about, weightlifting. Because I want to look up the studies. So pregnancy and its involvement with calcium and weightlifting on bones, on bone health. All right. Osteonecrosis of the hip is all right, we already discussed that. Although several surgical approaches have been used, the most definitive treatment of advanced osteonecrosis of the knee or hip is total joint replacement. Also, I don't know if I didn't say this or if it wasn't clear, but I'm reading the slide and then some of the slides have notes, which is what I'm reading after. So if it seems like there's like a disconnect in the material, that's why. All right, now we're on types of osteomyelitis. So hematogenous and osteomyelitis originates with infectious organisms that reach the bone through the bloodstream. Continuous spread osteomyelitis, secondary to a contagious focus of infection, direct inoculation from an exogenous source, or from an adjacent extraskeletal site. Chronic osteomyelitis occurs secondary to an open wound. So, this is going to be bone infections, including acute and chronic osteomyelitis, are known for their ability to cause pain, disability, and deformity. Despite the common use of antibiotics, they remain difficult to treat and eradicate. Osteomyelitis represents an acute or chronic infection of the bone. Osteo refers to bone, and myelo refers to the marrow cavity, both of which are involved in this disease. This infection can be caused by the following: direct penetration or contamination of an open fracture wound, exogenous origin, seeding through the bloodstream, that's going to be a hematogenous spread, extension from a contiguous site, skin infection in people with vascular insufficiency. What is a contiguous site? Let's look that up. So a contiguous site is a property or set of properties that are physically touching or share a common boundary, forming an uninterrupted connection. Okay, let's look up anatomy so we can get like an idea. So it's just like a limb. So like your two fingers touching together, the bones in your hand are near each other. So those would be like a continuous site. Dang, I'm gonna have to start getting ready for work. It's currently 2:20 and my shift starts at 3. What slide are we on actually? 19? Bruh. There's 40 slides. I feel like these slides have way more material than the last one. All right, osteoporosis. Osteoporosis is a medical condition characterized by decrease in bone density and quality, making bones fragile and likely to break. Key points about osteoporosis. Causes: aging. Bone mass peaks in the early 20s, and as people age, bone breakdown can outpace bone formation. Hormonal changes: decrease estrogen levels in women after menopause and lower testosterone levels in men can lead to bone loss. Lifestyle factors: sedentary lifestyles, poor calcium and vitamin D intake, and excessive alcohol consumption and smoking. Medical conditions: rheumatoid arthritis, that's what my grandma has, celiac disease, and hyperthyroidism are linked to osteoporosis. Medications. Long-term use of corticosteroids, steroids, or certain anti-seizure drugs can weaken bones. Signs of advanced osteoporosis. Loss of height over time, a stooped posture or Dowager's hump, back pain from collapsed or fractured vertebrae. Risk factors, non-modifiable. Age, greater risk in older adults. Sex, women are more at risk, especially post-menopause. Family history, ethnicity, higher risk in Caucasian and Asian populations. Modifiable, 1, diet low in calcium or vitamin D. Physical inactivity, or excessive alcohol or caffeine intake. Damn, I have to quit the coffee. Diagnosis. Bone density test. DEXA scans measures bone mineral density, BMD. T-score compares your bone density to that of a healthy young adult. T-score of -1 or above, normal. T-score between -1 and -2.5, osteopenia. That's low bone density. T-score of -2.5 or lower, osteoporosis. Prevention, healthy diet, adequate calcium intake, 1,000 to 1,200 milligrams a day for adults. 2, sufficient vitamin D, 600 to 800 IU/day or more depending on age. So, pause, sidebar on diet. This is why in the, I forget which part of our government, what is it, the FDA? Who controls the MyPlate? MyPlate. U.S. Department of Agriculture. First off, the reason why we have milk in there is because people need calcium. So even though a lot of people don't drink milk or are lactose intolerant, look for other options, they put milk there for the calcium intake. That's it. That's really the whole point of milk being on that plate. Mind you, they did not even have this MyChart plate of like what you're supposed to have in your diet until about 2010, 2008, like around that little realm, because these people who did research on what people need in their nutrition was like, hey, this is what we need, like this is what people need for their diet to be like healthy. And they're like, well, fuck you. And then they sued. It's like, no, people actually need this. Listen to our fucking research. And then they whipped out the MyPlate and like changed a few things. Like, I'll Google this for you so you can look it up. People who sued the US Gov about MyPlate. Lawsuits. The most well-documented legal action tied to the development of MyPlate and the dietary guidelines for Americans came from the Physicians Committee of Responsible Medicine. In 2010, they introduced the Power Plate, a visual tool similar to MyPlate but without a meat group. In 2011, the USDA unveiled MyPlate. It was strikingly similar to PCRM's Power Plate. So these physicians sued our government into putting this plate because they're like, this is what we need. And then they're like, fuck you, we don't need healthy Americans. And then got sued and was like, okay, we'll put out a version. But yeah, that is a little bit of tidbit of information for you about healthy diet. You should have learned that all in your pre-classes on nutrition for nursing. So that's just a review. Then it's going to talk about exercise, weight-bearing activities, walking, jogging. 2, resistance training, weightlifting. 3, balance exercises to reduce fall risk. So now we're going to look at, this is what I feel like these treatments and like showing you guys and Googling and reading these like articles and stuff is so important, because it's like you're not really going to know how to prescribe and give treatment or like advice unless like you've actually done like your own research on it. You know what I mean? Like you can learn all this in nursing, but there's so many cutting edge and so many things that like coming out about like new treatment options that it's like good to like research even while you're in school, because everything's always changing. Weightlifting exercises to help osteoporosis, scientific journals, scientific articles. Strength training builds more than muscles. So this is Harvard Health. So they've already done a publishing about this. And strength training in particular has bone benefits beyond those offered by aerobic weight-bearing exercise. It targets bones of the hips, spine, and wrist, which are the sites most likely to fracture. What's more, resistant workouts, particularly those that include moves emphasizing power and balance, enhance strength and stability. That can boost confidence, encourage you to stay active, and reduce fractures another way, by cutting down on falls. So it helps age-related declines in bone mass. Activities that put stress on bones can nudge bone-forming cells into action. Like if you look at the bone density of someone who weightlifts versus someone who doesn't, like it is astronomically different. Like you can, like it's insane. But so strength training, weightlifting, and 3 lifestyle changes: quit smoking, limit alcohol consumption. We both all know that that's bad regardless for any type. That's going to be brain function, like body functions, like you can even tell in your skin. So and then the final one is going to be bone health monitoring. So that's going to be regular screening, especially for women over 65 or men over 70. All right, I'm glad we talked about that. Treatment. So these are going to include medications. That's going to be bisphosphonates, so aldronate, risdronate, zoldronic acid, selective estrogen receptor modulators, SERMs, so e.g. raloxifene. I don't know if I said that right. All right, parathyroid hormone analogs, so teriparatide, monoclonal antibodies, so denosumab. All right, nursing considerations for osteoporosis. Encourage patients to stay active but avoid high-impact activities that may cause fractures. Modify the environment to prevent falls, so remove tripping hazards, install grab bars. Encourage regular checkups and adherence to treatment plans. All right. The next slide is going to be on medications. So rhabdomolysis is a serious medical condition resulting from the breakdown of damaged muscle tissue. This breakdown releases muscle cell contents such as myoglobin into the bloodstream, which can cause several complications, including kidney damage. So key points about, we're going to just stop after this slide, so that way I can look up the pregnancy about calcium, because you know pregnant women are some of the most probably seen patients, I would assume, for just like regular health and treatment, because they have to be monitored throughout their whole pregnancy. And I mean, there's so many, like if someone's pregnant, like there's, from what I've seen so far, there's so many things like you gotta watch out for. Medications are on, what exactly you're prescribing, what you're doing, how to protect, because that's not even just one patient, that's 2 patients at that point. The mom and the baby, that's like 2 separate beings. So it's like you're now having to like look out for 2. But let's finish this. So key points about rhabdomolysis causes. So 1, trauma or injury, 1, crash injuries, accidents, falls, 2, severe burns or prolonged immobilization. Overexertion is highlighted in this PowerPoint. So intense physical activity, especially in untrained individuals or extreme conditions, marathon running, CrossFit. Medications and drugs. Statins, cholesterol lowering drugs, especially when combined with certain drugs like fibrates. Recreational drugs, cocaine, amphetamines, heroin. Infections, viral or bacterial infections, metabolic disorders, conditions like hypothyroidism or electrolyte imbalances. 6 other causes: 1, heat stroke or hypothermia, electric shock, snake bites, or other toxins. Symptoms, this include muscle pain, especially in the shoulders, thighs, or lower back, weakness or fatigue, dark colored urine, cola or tea colored, Other symptoms include swelling or stiffness in the affected muscles, nausea, vomiting, or fever, confusion, or decreased consciousness in severe cases. So complications: kidney damage, acute kidney injury, AKI. Myoglobin released from muscle cells can clog the kidneys, leading to kidney failure. 2. Electrolyte imbalances. So 1. High potassium levels, hyperkalemia can cause life-threatening heart arrhythmias. 2. Low calcium levels, hypocalcemia, can cause muscle spasms or seizures. 3. Compartment syndrome, swelling within muscle compartments can cut off blood supply, leading to tissue death. 4. Cardiac arrest from severe electrolyte disturbances. Diagnosis. Damn, this is a lot on this one topic. This must be common. Blood test, elevated creatine, kinase. I know I'm saying a lot of this wrong, okay. A key marker of muscle damage, elevated myoglobin levels, electrolyte abnormalities, so hyperkalemia, hypercalcemia. Urine test, presence of myoglobin, indicated by direct urine. Other tests, kidney function tests to assess for kidney injury. More on this when we get to renal/urinary systems. Nursing and medical intervention. So 1, immediate goals. 1, prevent kidney damage. 2, correct electrolyte imbalances. 2, hydration. Intravenous IV fluids are essential to flush out toxins and support kidney function. 3, medications, diuretics in some cases to increase urine output. 2, calcium, insulin/glucose to treat hyperkalemia. More on this when we get to electrolytes imbalances. Dialysis may be needed if kidney function severely deteriorates. 5, address underlying cause. So stop offending drugs or treat infections. Prevention. Hydration. Stay well hydrated during physical activity, especially in hot conditions. Gradual exercise progression. Avoid overexertion, particularly if untrained or starting a new workout regimen. Monitor medications. Be aware of the side effects or statins of other drugs that may increase rhombodomylis. We're going to look up actually how to say this because this seems pretty important for me to keep mispronouncing. Pronunciation. My computer just pulls up all these ads and it's so annoying.
Say what you're looking for today. We are looking at how to pronounce these weird and more confusing vocabulary, including medical terms too many people. Rhabdomyolysis.
Rhabdomyolysis. Okay. So that may increase rhabdomyolysis risk, avoid risk factors, prevent prolonged immobilization, and manage conditions like hypothyroidism. Nursing assessment findings: severe muscle pain or weakness, dark colored urine or significantly reduced urine output, symptoms following trauma, extreme exercise, or heat exposure. All right, that's going to be done for today because I need to really go get ready for work. Pregnancy and its effects on women's teeth, relating calcium. Pregnancy significantly increases a woman's calcium requirements because both maternal and fetal needs rise. Adequate calcium intake is essential for fetal bone development, maternal bone health, and overall physiological function. Recommended intake: general adult pregnant women, 1,000 milligrams per day. Pregnant and lactating teens, 1,300 milligrams per day. I think everybody really should take a calcium supplement, and I honestly didn't realize this until, well, I always known because my sister would constantly break her ankle growing up or get sprains and hurt her ankles until the doctor was like, nah, she needs a calcium supplement because she wouldn't drink milk. And I know a guy who recently had his teeth pulled. He has an autoimmune disorder. He doesn't drink milk either because he's lactose intolerant. And he's he literally bit a piece of steak. his tooth straight up cracked. Just straight up cracked. Like, he just has poor calcium, I think, in his body, and nobody told him that he needs to take a calcium supplement. And I was like, you need to take a calcium supplement immediately. And like, I honestly feel like it's definitely essential. Like, you're supposed, like, it's for your all your bones. And see, that's why women, they start losing like their teeth and like having a lot of teeth issues as they get older, especially after pregnancies. And it's because the fetus needs it so much calcium to grow. It's like forming all the bones and everything, so it starts taking from you. So if you don't have enough calcium in the body, it's going to start going after what you got. And it's going to be your teeth, your bones, your health, everything. And we've already seen what calcium, how important it is in the body, what muscles, and all of it. So I think everybody should take a calcium supplement. But yes, I think that's it for today, or at least until I get off of work, which will probably be around 11 or something, 11 or 12, because it's Friday. But yes, we left off on slide 28, and there's 48 slides. So that's it for today, part 1 of diagnosis of musculoskeletal disorders. And yeah, I feel like we learned a lot. I will definitely be listening to this later. Bye now.